Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. This month, we're going to be focusing on breast cancer awareness. It's a topic that's near and dear to my heart. I know of many women whose lives have been impacted by breast cancer and who are survivors and who are warriors and who are on the tail end of treatment and have come out with negative results, and those who are in the thick of it right now. And so we're going to talk about breast cancer awareness this week. We're going to focus on that. So grab your friends, tag your sisters, tag your aunts, tag your neighbors, men, tag the women in your life, and make sure that they are tuning in to this session tonight. I want to thank you all so much for joining me in the month of September for the series on aging well. And this is a part of that. Aging well is making sure that we're taking care of our bodies. So let's jump into it. I'm so excited tonight. And as you guys know, I love my statistics. So I'm going to be throwing out some statistics, but I don't want to cause fear. This message is not to cause fear. It's not to have people to be afraid of going to get the exams. We're going to talk about protecting our breast health tonight. And as a woman, it's something that's so important to me. And I can say, I'm pretty sure I've shared my story here before. I want to say I was about 24 or 25 years old when I was taking a shower and I found a lump in my breast. And it was shortly after my grandmother had been diagnosed with breast cancer. And so, if you can imagine, I was terrified. I was very fearful. I was uncertain and just didn't know what to think in that moment. Even as being a healthcare provider, those same feelings came to me that I'm sure many other women experience day in, day out after they've been diagnosed with breast cancer, or if they get news that they are unsure of, or if they find a lump and not sure what to do about it. But I was able to tap into some of the resources that I had access to and was able to get screened. And at that time, I was in between jobs. I had just left one job and was transitioning to a new job. And my insurance had lapsed, because I was going to a new job. And so was without insurance and I needed help, but help was there and they were able to get me the assistance that I needed to get screened. And it turned out to be fibrocystic breast disease, which we'll talk about in another topic, but it was not cancerous. And so, because of that, I have to get mammograms yearly. And last year, my mammogram was a little different. The results came back abnormal. It wasn't cancerous. Thank God it wasn't cancerous. But if they had been, I was getting screened pretty early, and my doctors and my team was on top of it. But thank goodness it was not. And so I had to have a mammogram. After I had the mammogram, I had to have an ultrasound, and then I had to have an MRI. So yearly, I will be having MRI along with my mammograms. And so it's so important that we are proactive in our health and that we are doing all that we need to do. So tonight, we're going to talk about the things that matters most to our health, your family, and your legacy. And one of the topics is breast cancer awareness. So I'm sure we're going to be painting the town pink. We're going to be participating in the different events and the breast cancer awareness walks. And so I look forward to seeing some of you out and about in the community. October is Breast Cancer Awareness Month. And as I mentioned, tonight we're going to be diving into a conversation that every woman needs to hear. Did you know? Did you know that 1 in 8 women will be diagnosed with breast cancer in her lifetime? But here's the good news. Here's the good news. When it's found early, survival rates are over 90%. 90% if it's found early. Now, for certain populations, breast cancer is found later and it's more aggressive. And so that puts them at a higher risk for, complications and things of that nature when it comes to breast cancer. But we're going to talk about that a little later. That's why this conversation is so, so important. It literally can save someone's life, maybe yours, maybe someone that you know. So let's dive into it. Let's get real. Let's be informed. And most of all, let's take action. Have you scheduled your mammogram yet? Have you had your mammogram this year? If so, I want you to drop a heart in the chat. And I want you to drop a hands up in the chat, the little hands up emoji in the chat that you've scheduled your mammogram. And if you haven't, I want you to do something, this emoji. Put the little, I don't know, emoji or no shaking head or what have you, sad face. Because I want to encourage you. I want to stay in connection with you. I want to make sure that we get your mammogram scheduled. We're just at October 1st. We still have another 59 plus days in this year that you have an opportunity to get your mammogram done. So if you have not had an opportunity to do so, today's the day. Put it on your calendar, schedule an alert on your phone, schedule an alarm on your phone to remind you first thing in the morning to schedule your mammogram. It is so important that we do so. Here's what we know. Breast cancer is the second leading cause of death of cancer in women. Only about 65% of women are over the age of 40 are up to date on their mammograms. That means nearly 4 in 10 women are behind. So when we think about it, if we're in a room with some of our friends and there's 10 of us, 4 of those women have not had their mammograms. That's a large number. And it's something that only takes about 15 minutes. I'm not going to tell any lies. I'm not going to tell any stories. It can be uncomfortable, but 15 minutes of being uncomfortable could essentially save your life. And here's something that hits home. Black women are 40% more likely to die from breast cancer than white women. Even though we get similar rates when it comes to it. Black and brown women are at a higher percentage of dying from breast cancer. Even though we get it at similar rates, is what I wanted to say. If we were to compare a white woman and a black woman, the rates of breast cancer diagnoses are about the same. However, Black and brown women tend to be diagnosed at later stages and with more aggressive types of cancer. That tells us that access, awareness, and early detection and action is so important. It's key. It's key. It's not about fear. It's about power. Taking power into your hands to be able to advocate for yourself. When we know better, we do better. And so I'm here to encourage you tonight. I am here to encourage you tonight that if you have not scheduled your mammogram, now is the time. I'm going to say that a million more times as we go throughout this session tonight. Schedule your mammogram. Ma'am, sis, sir, for the women in your life, encourage them to schedule their mammogram. If you're afraid, if there's some fear, take someone with you. I'll go with you. DM me if you need someone to go with you. You might, now granted, if you're in the Central Florida area, I can't, travel out of the state, but take someone with you. And if you're in the Central Florida area and you're afraid of going by yourself, reach out. If I can't go, we'll get you connected with somebody who can. Let's talk about what actually raises our risk. So it's important that we understand our risk. Let's say you have a family history, your mom, your sister, or aunt with breast cancer, you're at a higher risk. If you have a specific genetic mutation or BRCA gene, you're positive for the BRCA gene, these are inherited, but it can be tested. And so it's important that if you have that family history, that you also do the genetic testing to determine if you have the BRCA gene. Your age, risk increases over the age of 40. Hormonal exposure. So long-term hormone therapy, early periods, say you start your periods pretty early, or if you go through menopause later in life, meaning that time frame of perimenopause to menopause is extended, you are at a higher risk for developing breast cancer. And again, this is not all about doom and gloom. It's about making sure that you have the information that you need to be proactive and not reactive when it comes to your health. Lifestyle, obesity, lack of movement. And I'm going to say it again, 30 minutes of moderate intensity exercise 5 days a week or 150 minutes of moderate intensity exercise a week is so important. I'm going to throw this caveat in. Many of us work from home, we work in offices. We're sitting all day. I just attended a conference and I was astounded at this. It was astonishing to hear this. That even if we meet those target goals of 150 minutes of exercise, moderate intensity exercise, where your heart rate is elevated, right? Even if we meet that goal, if we're sitting 8 hours a day, it pretty much negates that, it wipes it out. So if you're sitting, I want you to set your alarm on your phone every hour to get up and move around. You may not be able to get up and move around and walk outside of the office, but get up and maybe do some steps or, start moving your feet while you're at your desk. Do whatever you can. Moving your arms, get up, stand up, sit down. Some movement, any movement is important as opposed to sitting in a chair 8 hours a day. I want you to drop a hands up signal if you have a family history or you've ever wondered about your risk level. This is a safe space. And I want to make sure that I pay attention and that I get you the resources that you need. There is a calculator that's available online that you can utilize to determine your risk level of developing breast cancer. And you just answer a few questions and it gives you your risk level. Now, what can you do with that information? You can take it to your healthcare provider. You can have a conversation with myself or another provider who may be able to give you some guidance and direction on what you need to do next. But the first step is making sure that you are getting your screening early and you're consistent with it. And we'll talk about the guidelines on when you should be getting screened, but lifestyle protection and things that we can do. The good news is there's so much that we have within our control when it comes to breast cancer. One thing I can recall when talking to a friend of mine who recently went through breast cancer, and she said to me, I just feel like I'm out of control of everything that's happening to me in my body. And I just sat and listened and I hugged her. I just hugged her and loved on her. Move your body. Even brisk walking 30 minutes a day helps. Eating more plant based foods, broccoli, the leafy greens, berries, these protect your cells. We talked about in our series on aging well the foods that we can eat that help us, the foods that we eat that fuel our cells and are protective. And so it's important that we add these foods onto our into our diet each and every day. Small changes help. Small changes help. Is so important. Limiting alcohol. Each glass adds on to your lifetime risk. And so as I mentioned before, I'm not about telling anybody what they can't eat or what they can't have. You can drink and eat whatever you want. Just be mindful and moderation with all things. And then maintain a healthy weight, especially after menopause. As we know, women, we tend to gain weight around our bellies during menopause. Like I've never had a belly. Perimenopause and, wherever I am in that spectrum right now, I got a belly and it's hard to believe. So what am I doing? I'm working out. I'm making the changes that I need to change to make sure that I am getting and staying healthy. What's one healthy habit you're working on this month? We're in a new month. Let's keep each other accountable. For me, and I started this a while back, we're walking at least 3 miles a day. I've now added my weighted vest, but that's my goal. 3 miles a day. My motivation is to make sure that I'm hitting my heart goals each week, and I'm doing. So when should we get screened? Recommendations. So here are some early detection. Here's where early detection saves lives, right? So the mammogram guidelines is individuals, women between the ages of 40 and 74, get a mammogram every 1 to 2 years. Don't wait until you're 50. We're finding that breast cancer diagnoses are happening earlier and earlier. If you have a strong family history of, or your BRCA have that positive for BRCA mutation, you want to start earlier, around age 30, or whenever your healthcare provider, recommends it. You may need to also have a mammogram, MRI in conjunction with your mammogram. And that's where I am. This year I had to have an MRI. And when I tell you, I told my friend, I said, listen, you did not warn me. That thing was so uncomfortable. But 30 minutes of being uncomfortable for a procedure that could potentially save my life, I'm here for it. I've done worse than that. I've been in more positions that where I was uncomfortable. And so this was something that I needed to do to get it done. And I'm telling you, I was in there praying and deep breathing and singing worship songs, but I was able to get through it. Even if you feel fine, screening matters. Most early cancers are found before the symptoms appear. Once you begin to have symptoms, usually the cancer is has spread to a higher, a more aggressive form or has involved more tissue. And so it's important that we screen early. And again, a mammogram takes about 15 minutes and it could add decades to your life. Even if there's a positive result, there are options. So genetic testing. If you have multiple relatives with breast cancer or ovarian cancer, you want to talk to your provider about genetic counseling. Knowledge is definitely power. So if we know this information and we talk with our healthcare providers, we complete the screening, get the genetic counseling done, they're going to run and tell you what your risk is for developing a specific type of breast cancer. Or if you have that BRCA positive gene. And let me put this caveat in there, men can also develop breast cancer and men can also be BRCA positive. So it's important that everyone is getting screened if they meet criteria. And again, we've talked about this in the past. When you're having your annual wellness exam or annual physical exam, your healthcare provider should be performing a clinical breast exam. A clinical breast exam. Some guidelines make it optional, but I always say have your provider check during your annual visit. And as providers, that's something that we should be offering to all of our patients because we may be able to pick up on something that they're not. And even though you're getting that done or potentially having that done once a year, there's something that you can do each and every month. You can do your self breast exam. It's normal. Know your normal. You should know your body more than anyone else. I can remember a friend of mine who was diagnosed and who is now a breast cancer survivor. Her husband found her breast cancer. Her husband found her breast cancer. And if you know your body and you know what your normal is, if you see or feel something off, skin dimpling, nipple discharge, lump swelling, redness, warmth of the breast, you know that something's not right. Don't wait, say something, go and get care immediately. And right now, I know, and I hear it often, the appointments take so long. They're scheduling me 2 and 3 months out. Reach out to us. We are offering same day, evening, weekend, early morning appointments. We may be able to help kind of navigate that for you. So if you're not able to get into your healthcare provider, reach out to us. Let's see what we can do to help. When was your last mammogram? If it's been more than a year, type schedule it in the comments and in the chat. And let that be your reminder. And I will also be your accountability partner. I'm going to bug you until we get it scheduled, until you get those results. Now, let's be honest. These conversations can bring up fear, it can bring up anxiety, and it can even bring up guilt. But it's okay to feel all of that. Take your time, navigate it, sit with it, but don't delay scheduling your mammogram. As I think about my scare with breast cancer and not knowing if it was, I thought about my grandmother. I thought about some friends of mine who've been through breast cancer. I thought about my aunt who passed away from breast cancer. I thought about women that I know who passed away and died from breast cancer. And fear can set in, but I use that as motivation to make sure that I'm taking care of myself. Some women delay and avoid screening because they're scared of the results. And I've heard, well, if I don't know that there's something wrong, then I'll feel better. And if there is something wrong, what am I going to do about it? There are options. There are options. But sis, fear can't save you. Faith, community, and action can. Being surrounded by others who can help support you and can help push you, That's what we're here for. And if you're nervous, bring a friend. Like I said, if you're nervous, bring a friend to your appointment. If you survived, share your story. If you've lost someone, honor their legacy by taking care of yourself. That's what drives me. One of the things that drives me to take care of myself. This, I want you to tag a friend or a sister who needs to hear this message tonight because you could be saving their life. I want to take a moment to just encourage you. Here's your action step. Schedule your mammogram. Don't delay, don't overthink it. Call your healthcare provider today. And if you don't have a primary care provider, call Wells Legacy Health and Wellness and we will get you going. We will get that in order for you and get you scheduled. And if for some reason you are one of the individuals who does not have insurance, we work with an imaging center that gives really great discounted rates for individuals who don't have insurance and you're paying cash, credit card, or what have you. Prevention is your superpower. And if you're watching this as a survivor or a supporter, we celebrate you. You are the heartbeat of this movement. The survivors, the warriors, you are the heartbeat of this movement. And before I go, I want to encourage you to drop a heart in the chat if you commit to either scheduling your mammogram or reminding another woman to do so. Your body is your temple, and it's the only one that we have. And so we have to make sure that we're taking care of this body. And if you've been watching and you've been listening to me on social media, I've been talking about perimenopause and menopause and how your body's not betraying you, it's evolving. Your body's not betraying you, it's changing. There's evolution happening. And so we have to make sure that we're staying on top of it. Your body's talking to you. Are you listening? Listen, love it, and protect it is so important. Together, we're creating a legacy of good health. And it starts today by you scheduling your mammogram. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Stay safe and be well, and schedule your mammogram. Until next time, I'll talk to you later. Bye.